So the biggest impediment in implementing digital innovation in clinical trials is really around stakeholder buying and changing the mindset. And the second component around that would be the financial aspect of putting together a business case that is solidified by data that we can actually see being captured in real world and in a clinical trial setting. The problem is a lot of that data is done anecdotally and is one-offs. And we don't have a large bolus amount of that data to justify broader business, buying or bottom line impact. But as the industry progresses and using these types of technologies more and more in clinical trials, more different types of data sets are being generated, and as a result, you will be able to get much more quantified value out of it. The types of innovation that offer the highest ROI are the most simplistic one. Digital innovation is really not an analytical science, it's not an IT science. First and foremost, what most people need to understand is a behavioral science. So how does that innovation going to fit into that person's daily schedule and daily life? The type that actually get the largest ROI in terms of investment and resource are the ones that are not digital by nature, but could be used to get that data and then add a digital backbone at the end to mine it and then create a broader structure around it. Innovations around patient questionnaires, surveys, trial simulations that are done in a human face-to-face setting or hands-on setting are probably much more valuable than what you're getting in terms of capture of endpoints through mobile applications or wearables from that perspective. Because really you're getting data from the source at that point from the patient, and you're seeing the patient, you're seeing the HCP, you're interacting with all of the stakeholders at once. You can put that data in a database, you can mine it for the future and really create something valuable out of it. So the key stakeholder here is really the patient, because ultimately without the patient's input and feedback on any kind of digital innovation they're using in clinical trial, that innovation is useless because you're not getting the right data out of it. So really to make it as most patient-friendly or efficient is your key goal here. What you want to do at the end of the day from a sponsor's perspective is reduce patient burden. So to give you an example, right now the average patient travels about 2 hours one way to a clinical site. That means, not of course, their general PI may not be participating in the clinical trial, so they may have to go find another HCP who is doing that at that point. With that said, what you want to do is look at your protocol design and create in a way that you take some of those burdens out. So maybe do some of the visits at home or include novel technology that you can capture that data virtually or remotely from that perspective. So really the patient is the number one stakeholder here with any kind of design format you want to keep in mind. The second one here is the site. And really, I guess with the site perspective, what you mean is taking some of their work out of the way. So the average investigator, when they first sign up a clinical trial, they don't realize the amount of administrative burden that is going to be imposed upon them. They think we're doing the clinical trial, we're going to help the patient, etc. But the amount of paperwork that goes with it is enormous. You may have, in terms of data points, about few thousand data points per patient across the course of a trial. All those data points need to be transcribed and entered into a system and then verified to make sure there's no queries or outstanding details around them. So including digital innovation where you can automate some of the capture and review processes for this will not only save time for the PI, but also save time for the coordinator supporting the PI and ensure the efficiency stays.